D in diabetes and other metabolic disease management. Let me talk with the present prevalence. You will be surprised that 1 billion people worldwide are deficient, and probably it is more in, all over the world, people are vitamin D deficient. And 50% of the population have vitamin D insufficiency. And to be very frank, as a clinician, as a practitioner, we ask for each and every person to get vitamin D level. Unless they are on vitamin D replacement therapy or a maintenance therapy, we found almost everyone who is coming to our clinic is vitamin D deficient, including myself. When I got checked it before a few years, almost like 2 decades back, we found it is less, and we are taking continuously, regularly a maintenance dose. So you can understand the vitamin D deficiency is really very prevalent. This is one data which is talking of 35% of adults in US are vitamin D deficient. In India, this deficiency is 50 to 94%. And I'm absolutely agreeing with this data, because as we see, people are having higher vitamin D deficiency. It higher occurrence in young adults, pregnant, lactating, and postmenopausal. In hospital, the data is there to show that it is 1/3 to 99%. As I told you, that only those people who are actually taking replacement, they are only normal. Otherwise, most of them are vitamin D deficient. The older people, 96% in India. This data is all over the world. And there is one data which shows that in Pakistan it is 72%, in Iran it is 67%. I don't know why. From India, they are better in vitamin D deficiency, but I believe that most of the Asian countries, vitamin D deficiency is very, very high. And this is a huge prevalence of vitamin D deficiency in our country too. Now, what is the cause? First of all, let us understand when you should call vitamin D deficiency. Less than 20 is vitamin D deficiency, nanogram per ml. But some of them have severe deficiency, less than 10. That is the condition when patient may have even symptoms of vitamin D deficiency also. It's better to maintain around 30 or 30 plus. That is what 30 to 50 is optimal range. So I want by most of the patients, they should be in this range. If they are on 30 to 50, they can be on maintenance dose. There are people who keep on taking sometime more amount of vitamin D, either injectable form, then it can increase too much, then it can lead to toxicity also. But many of our patients are in the condition of below 20. This is what we see. If even someone is between 21 to 29, we still call it insufficient. Now, what could be the causes? The commonest cause could be still the exposure to sun. Then, even we have exposure, it is the sunscreen. Even we have exposure, it is our dark skin. It is the melanin which is available. Even it is the sun is there, it is high latitude. It is not in a right way. Even it is there are winter situations and air pollution. All of them are responsible for that. What medication can lead to vitamin D deficiency? It's an anti-epileptic. It is hard. It is corticosteroids. It is rifampicin, and it is St. John wort. These two conditions are normally taken care by surgeon. Then liver failure, kidney failure, nephrotic syndrome, even obese people. And obesity, we know almost 1/3 of the people are obese. That is also the cause for vitamin D deficiency. There are intestinal malabsorption also, IBD, cystic fibrosis, celiac disease, bile insufficiency, gastric bypass, cholesterol or olestra. These are the reason why they are not getting absorbed. And they are the condition where you have to give injectable vitamin D. That's an official indication for intestinal malabsorption. Plus that, American Association of Clinical Endocrinology put that when we should call vitamin D deficiency. Now, shadow role. This is very interesting. I'm sure those who are knowing that, how much sunlight should come. If your shadow is longer than your height, there are insufficient ultraviolet B rays from the sun, and you will not able to synthesize vitamin D. If your shadow is shorter than your height, then you are able to produce vitamin D. This is something very, very interesting paper to show that how vitamin D, what is the latitude what should have. What are the multifactorial condition which requires, and they are connected or associated with vitamin D deficiency? Definitely cardiovascular disease, diabetes today as we are talking, even the immunity level also decreased, and infertility to have issues related to vitamin D. So there is a missing link between a potential of managing multiple multifactorial condition with vitamin D level. Vitamin D in orthopedics, it is bone marrow density with the people with vitamin D. And we know that by vitamin D supplementation, it improves quality of life and physical performance in people with osteoporosis or arthritis even. Low vitamin D have higher post-operative complication, and this is what we have seen in our orthopedic departments, that they keep on saying that people are getting more complication. Vitamin D treatment improve vitamin D deficiency when improving bone density indices and reduce the incidence of osteoporosis. So if you find someone who is vitamin D deficient, it has got huge benefit as far as bones are concerned. Anti-fracture efficacy is increased significantly with higher vitamin D achieved level. Vitamin D in cardiovascular disease. Again, very, very important problem which we see very regularly. Its deficiency is always there, but it increases cardiovascular mortality rate. It is associated with hypertension MI. It is associated with heart failure. It is associated with complete clinical improvement in heart failure. So, I mean, you give vitamin D, you will find there is a CHF is improved, and it results in abnormal lipid profile also. So, vitamin D is anti-hypertrophic, inhibitor of cardiomyocyte proliferation, stimulator for vascular smooth muscle proliferation. It expresses VEGF. It is inhibitor of RAS. It is anti-fibrotic. It is antioxidant. It is anti-inflammatory. So vitamin D is actually having multiple roles. And when I talk about the CBD, they have also anti-hypertrophic, inhibitor of cardiomyocytic proliferation, and stimulation of vascular smooth muscle cells. So vitamin D replenishment confers substantial cardioprotective benefit. Suppose someone is keeping around 47 in the female, they are protected much better in compared to people who are not taking vitamin D as a replacement therapy. Vitamin D status correction induces HDL, which prospectively reduce 10 years ASCVD risk. So if I just give vitamin D, it is going to improve the SDLC, and which prospectively reduces 10 years ASCVD risk also. Vitamin D deficiency is associated with increased risk of likelihood of having diabetes and pre-diabetes. Vitamin D deficiency is significantly associated with high all-cause mortality in patients with diabetic foot ulcer, and vitamin D supplementation can be regarded as an effective way to prevent the progression of diabetic nephropathy. So this is very, very important for prevention for pre-diabetes and diabetes. Also in the help of uh, having more chances those who are having vitamin D deficiency and all-cause mortality in patients with diabetic foot ulcer. If I explore, these are the three common conditions, and they actually affect skeletal health. Whether it's obesity, insulin resistance, vitamin D, the first thing to start with them on insulin sensitizer. First, we give sulfonylurea. So first time we should come to somebody who is taking care of them on walking track or sort of a insulin resistance which can be decreased. So that skeletal health can be improved by giving vitamin D. If we can decrease obesity, also it will help, and insulin resistance improvement too. Vitamin D deficiency in diabetes, it decreases functional beta cells, insulin sensitivity, modulation of calcium influx, chronic inflammation, and regulation of calcitonin. It decreases polycystic ovarian syndrome, also the risk of PCO. Otherwise, it's a disease of because of insulin resistance only. In obesity, it increases vitamin D receptor expression. So it's actually in a metabolic syndrome. It has got all problems: metabolic issues, apoptosis, impaired glucose tolerance, hepatic unclow, and increasing renin and angiotensin system that increases the cardiovascular risk too. Vitamin D also improves type 2 diabetes markers, which is umbrella analysis, 38,000 participant, fasting sugar was better, HbA1c which been done, and HOMA IR also. And this had improved significantly, not only the diabetes, but it also helped in decreasing HbA1c, fasting sugar, and HOMA IR. This umbrella meta-analysis showed that vitamin D has lowering effect on various biomarker of type 2 diabetes. It is used in pre-diabetes also, where it had shown significant benefit. And this is what the maximum benefit was seen when vitamin D level was more than 50. So this is something, again, whether we should keep up to 30 normal, because the data is showing more than 50, right? If we do it more than 50, it has got more benefit. It is 0.84. 76% reduction, even in type 2 diabetes metabolism to get it. It means person can prevent type 2 diabetes also. Vitamin D prevents development of type 2 diabetes in pre-diabetic population. Risk of post-operative ARDS is high in severe deficiency of vitamin D. So post-operatively, we see a lot of people who develop lung problems. So if they have good vitamin D, probably we can say that it decreases. Vitamin D was safe and it protects against acute respiratory infection. Insufficient vitamin D3 may increase COVID-19 infection risk, severity, and mortality too. Vitamin D deficiency favor exaveration and affects asthma control. Vitamin D and immune system, slightly busy slide, but you can understand that it hacks actually at every system. That's innate immune system. It also works, and lot of uh, studies been done on immune system. You can see here how it helps in improving the immune system too. The oxidative stress, actually in diabetes patient with, I have shown you the obesity, insulin resistance, how it increases the oxidative stress because they have already low vitamin D, and that helps for increasing oxidative stress, which is increasing reactive oxygen species is also very, very important where it works. There is a potential mechanism of modulation. By giving them vitamin D, you can have improvement in other organs also, mainly with adipose tissue, pancreas, skeletal muscle, and for immune system. They produce three type of immune system, and by improving vitamin D, actually you are decreasing calcium level in the blood, which will increase bone reabsorption, and it will also help in central nervous system for hunger too. And this will increase the skeletal muscle mass, overall skeleton, and that will decrease the chances of osteoporosis. There are multiple paper and data to show that vitamin D supplementation with or without calcium on obesity and diabetes. You will find there are multiple papers on this, and most of the papers is talking that if you put the patient on calcium vitamin D, it will be helping them for further progression of osteoporosis if they have. This is one more trial, I mean, meta-analysis, where multiple companies have put from which oral vitamin D they have used it. Active vitamin D treatment is not only for diabetes management, for prevention, but it also prevents sarcopenia. We know that sarcopenia is a muscle mass is decreasing, our protein intake may be decreased. That may be the reason. So give them vitamin D and try to see that their sarcopenia and muscle mass also improves with this. Vitamin D deficiency, even it is working in OBGY center in associated with significantly PCOS, which is what the insulin resistance. It supplement improves PCOS parameter, and it high risk pregnant women in the first and second trimester has effective impact on gestational diabetes. It improve preeclampsia and placenta mediata complication. To summarize my talk, vitamin D deficiency is hugely prevalent condition. Its deficiency is pivotal role in pathogenesis of multiple disease other than most. Deficiency of vitamin D is found to be associated with pathogenesis of multiple diseases, and its supplementation also proven the beneficial. Considering the available evidence, vitamin D should be given a utter importance in managing these conditions, and particularly diabetes also. With this, I thank you. Can take my mail ID also, and you can write any message related to vitamin D or diabetes or metabolic condition, and also we can get connected on mail. Thank you. Thank you.